Hi, I'm Dr. Michael Henry. I'm the clinic director here at TexStar Chiropractic Clinic, and I want to talk to you a little bit about a common condition that we see, knee pain. And knee pain is really a group of conditions, but that's the main symptom that most people have. So I'll tell you a little bit about myself and our clinic. Like I said, I'm Dr. Michael Henry, DC. I'm a chiropractor here in Austin, and I've been practicing for about 8 years now. I'm a member of the Board of Chiropractic Examiners, which is a governor-appointed position. We regulate and license the chiropractic profession here in Texas. I've also done lectures for the UT Medical School, the surgery department, focusing on chiropractic rehab techniques and cold laser therapy. Another accomplishment that I've got is that I've done some postgraduate training in functional neurology, and so one of the things we're going to get into today is some neurology and how it affects knee pain. So the mission of TexStar Chiropractic Clinic is that we want to bring non-surgical approaches, non-drug approaches that are really effective to help people be able to treat these neuromusculoskeletal conditions, these conditions that involve nerves, muscles, and joints. That's really what we specialize in and what we're really good at. So today we're going to focus on chronic knee pain, so we're going to get into that just a little bit. So let me just ask, who here has knee pain?
I definitely do.
Okay, it looks like most of the people here. So let me ask you, how long have you had the knee pain?
I would say really the last couple, 2 to 3 years.
Okay, so chronic knee pain is really the more common issue that we run into. That's the things that don't respond to normal treatments, that don't respond and heal on their own. How's that affecting your life? What's it limiting you from doing that you want to do?
Well, really walking and hiking, that's really what was keeping me healthy, and I haven't been able to do that.
Anybody else relate to that? Not being able to get out and walk where you want to walk, go on, experience the Austin outdoors, which is what a lot of our patients have a problem with. So we're going to address that, and we're going to talk today. The reason we're talking about chronic knee pain versus the more acute knee pain, like the football player who gets tackled from the side and the knee buckles, well, those are acute injuries that we already have good treatments for that. People who have those kind of injuries are already getting help. What we see a lot are these chronic knee patients that have been dealing with this for years on end, and so we've found an answer for that. We found something that works in 90% of the patients that we see. And so we're going to get into that a little bit today. So about our results. So like I said, we see improvement on the first visit in about 90% of the cases that come into our office. We have a 2-visit guarantee, which means that if you don't see improvement within the first 2 visits, we won't take you as a patient. So it's very few that we have to turn away, but it does occasionally happen because if we don't see our improvement that fast, we don't think that this is the solution for you. So I'm going to get into what that solution is here in just a few minutes. Let's see. So I'm going to ask you, John, on a scale of 1 to 10, what do you think your knee pain is today?
It's about an 8.
Okay. What's it keeping you from doing that you really want to do?
I would like to be golfing a lot more.
So if we could get that pain down to a 1, you'd be out there on the links playing a little more golf?
Yes.
Okay, great. So that's one of the big things we want to do is to figure out what our patients want to be doing and get them to the point where they can get out and do that. Okay, so how we get our results. I'm going to go into that, but first we need to go into a little bit of anatomy so that you can understand a little bit more the complexities of knee pain. So let me grab a marker here. So who knew that there were 5 vertebrae in the lumbar spine? Yeah? Okay, one person knows. All right, so we're going to go and draw those out. So these 5 vertebrae are big vertebrae today. Okay. This is L1, L2, L3, L4, and L5. Okay. And so between each of these vertebrae, there's actually nerves that come out on both sides. And we'll get into that a little bit later. So who knew that there are 2 bones that make up the knee? Okay. There's really 3 bones in the leg. The 2 big bones that make the knee joint up are one up at the top, called the femur, and one down at the bottom, called the tibia. You've got a fibula, but it doesn't really affect the knee joint, so we're not going to really get into that today. So on that knee joint, on those bones, you have 6 muscles on the front. So this is the front of your leg. So 4 of those muscles run right down the middle of the top of your leg, and those are called your quadriceps. Anybody know what that muscle is? Yeah, exactly, that big muscle right in the front. Okay, so you have one that runs across, called the sartorius, and then one that runs right down the inside of the knee, called the gracilis. Okay, out of you guys, who has medial knee pain? Yeah, both of you, right? So one of the things that we see with these kind of conditions is that medial knee pain is way more common. We probably see that in 80 to 90% of the patients that come in. It's a much more common thing. What it usually is that we have a muscle imbalance in here that's caused some wear and tear, and so we'll get into addressing that a little bit more as we go. So back to our nerves. So there are 4 nerves in your spine that control the entire knee, and what that is L2 goes to the front of the knee, L3 comes up and joins it, and L4 comes up and joins that. These all form the femoral nerve. Alright, so the femoral nerve runs all the muscles on the front of your leg. Okay, now let's look at the back of the leg for just a second. So on the back of the leg, same 2 bones, femur, tibia. We have 6 more muscles. Now these muscles, that's a pretty narrow femur there, but we're going to try to make them fit. 1, 2, 3, 4. So you've got 4 big muscles on the back of your leg too. You know what those are called?
Hamstring.
Hamstring, that's right. All right, so we have the hamstring muscles that run across the back, and we have one muscle that runs across the knee, which is called the popliteus, and that's what allows your knee to bend, to unlock and lock. That's why when you feel like you lock your knees, you're actually engaging that popliteus muscle. Now, we have another large muscle that runs right along the back of the knee and into here. Anybody know what that one is? Any?
The calves?
The calf, that's right, yeah. It's called the gastroc, so calf muscle is what we're looking at there. Okay, so the interesting thing about the back of the leg is all of that comes from the L5 nerve root. And the fun thing about L5 is it also controls the foot, the sensory portion of the foot. All right, so anybody get numbness in their feet? Okay, how about back pain? Right? How about all 3? 1, okay. So it's actually really common to see more than one of these issues, because if you have any kind of problem down here in the low back, it can affect the nerve that runs to the sensory part of the foot, as well as the muscles in the back of the leg. So we see knee pain with foot numbness and low back pain really commonly. And how this happens, how you get that damage, is called stenosis. So if you have 2 vertebrae that are too close together in your low back, you actually get compression on these nerve roots that come out here. And when you do that, it affects these different areas on the leg. Now, the interesting thing about these nerve roots is they're actually made up of 9 little fibers inside of it. So if you look down the middle of one of these nerves, you can see a bundle of 9 nerve fibers inside. And each one of those nerve fibers does something different. So if we go to our 9 nerve fibers, 2 of them control pain. So when you have that pain in the leg going down the back there, into the calf, sometimes in the foot, sometimes in the buttock, what you're running into is you have a problem with 2 of those nerve fibers. Now 4 of those control muscle function. So if you have that weakness when you're stepping up on stairs or onto curves, or if you feel like that leg just wants to give out on you sometimes, what you're having a problem with is that the muscle function, the nerve fibers that control muscle function, are either weak or they're not firing correctly. How about leg cramps? Anybody? Yep, okay. So those leg cramps are when those muscle fibers are not firing correctly and you start to get those crampy sensations in the muscle, as well as restless leg syndrome is usually a nerve fiber issue. So 2 more, control blood flow. Anybody get cold feet? All right. So what we're looking for when we look at the blood flow is that if you have cold feet, especially if it's one-sided, we know there's an issue with the nerve controlling the blood flow down to that region, or we suspect it. So that's one of the things that we would always evaluate. The last one is probably the most important one, balance. Balance and touch, all from the same fiber. And so you have one fiber that controls balance. That's how your brain and your feet talk to each other. And so if the nerve that controls balance is affected, you'll have things like falls. You'll feel like you may not be able to feel what's going on underneath your feet. Balance and touch are hugely important and a really big risk, especially in our older population, because if you lose that nerve fiber, if you have damage up here, it can be really dangerous. And so what happens with stenosis is that you can have damage on just one little aspect of that nerve fiber, and it can only affect pain. Or you may have damage a little farther through that, and it may affect pain and blood flow, or pain and balance. Or it can be everything on there where you're starting to get you have no sensation, balance, muscle weakness. Those are the more severe cases, obviously. But we see any pattern, any combination of those things on any part of the leg, knees, or feet. So that's really what we're going to look for. The reason we have such high success is we don't just focus on the knee joint. That's really the more acute pain when you have tears and trauma. That's when you want to focus on the knee joint. When you have chronic pain, it's not just the knee joint, or it would have gotten taken care of already. That's where traditional approaches can be more effective. What we do is we're going to come in and we're going to look at your lumbar spine. We're going to look at the knee joint. We're going to look at all the muscles involved as well as the nerves that go to those. So if this all makes sense to you, what we want to do is have you come into the office. We'll do a full exam. We'll take any necessary x-rays that we need to of your low back, take any x-rays of the knee. We're going to do a neurological exam to make sure that all these different nerve fibers are functioning. So all these fibers as well as these different nerve pathways. We're going to check all of that. And we'll do that for $165. That's what it costs to come in and get a full exam, and then any necessary x-rays. So $165. Now remember, we see improvement in 90% of our patients within the first visit, and if you don't show improvement by the second visit, we won't take you for care. So there are a small number that we have to turn away, but for the most part, we see really great improvement. So all you're risking for these $165 to get that initial exam, evaluate all of this, take any necessary x-rays, and do 2 free demo treatments to make sure that you're a good candidate for care. All right, so I want to thank you for your time today, and thanks for being here, and we'll let you go.